Arcadia News.
If you have varicose veins, swelling, or pain in the legs, they could be signs of a more serious problem. Here to explain is Dr. Dale Payne, cardiothoracic surgeon at Arizona Vein and Laser Institute. Hi.
Hi, Gina. How are you?
Good. Tell me, what is a chronic venous insufficiency?
Chronic venous insufficiency is a term that's been used for many years to describe a variety of symptoms that have to do with failure of the valves in the veins in the legs, causing numerous symptoms. Symptoms such as swelling, varicose veins, ulceration around the ankles, discoloration. There's a variety of symptoms that are related to that, and most people will notice them mainly as varicose veins, but they can progress into many symptoms.
And what causes something like this?
Most chronic venous insufficiency related to the failure of the veins is hereditary, but it's more common in women. Although 25% of the cases are probably men, more common in women who stand at work and women who are pregnant. And obesity. Many of these things are directly related to the increase in venous congestion in the legs, the swelling, the itchiness, the restless leg syndrome. That's related to chronic venous insufficiency.
It sounds really painful. How is something like this diagnosed?
It's diagnosed by first by looking at the legs. You can tell almost right off the bat whether somebody's got chronic venous insufficiency. The reasons for it can be various, but most common is what I described as the valves and the veins in the legs for a hereditary reason, and for what I described above, obesity, pregnancy, standing for long periods of time can contribute to that.
So what are some of the treatment options available to people?
There are many treatment options. We used to strip the veins many years ago. I mean, not that long ago, 20 years ago. I guess I'm getting older, but we used to strip the veins through incisions. Now we can burn the vein, inside the vein, under local anesthesia. With a laser. There's other different ways of burning, but we use a laser that heats up a tip under local anesthesia. We can also do chemical ablation, and on the big veins that really pop out all over the place, we can do what's called phlebectomy, where we make a little nick incision under local anesthesia.
Well, let's take a look at what some of this might look like for people, and what the difference kind of would be between a healthy vein and a vein that isn't healthy.
Okay,
what are we seeing here?
This describes insertion of a laser into the vein itself, and into a vein that's not working properly. And this is the first of the slides, where the blood is supposed to go up and supposed to get trapped at these numerous different valves. In venous insufficiency, for hereditary and other reasons I talked about, the valves aren't working properly, and the blood comes back down and pools at the ankles.
Wow. And so this is the laser treatment.
This is a laser treatment where we insert a very thin fiber. So this looks like a thick fiber, but it's a very thin fiber that goes up into the vein, and under local anesthesia, the tip of it gets very hot, and it burns and destroys that vein.
And you've made it really easy for people to come in and get screened and get more information.
Absolutely. They can come in almost any day, and Monday through Fridays.
And you've got many locations throughout the valley.
Many locations. We have 5 locations now.
5 locations.
Yeah.
And you're usually at the Chandler office,
Usually at the Chandler.
correct?
I'm also at times at an Avondale, and also down at our newer office in Phoenix, pretty close to here, off of 7th.
Very important then for people to come out and get that free vein screening if they think they might be having some problems.
Yeah, absolutely.
Very serious consequences. Thank you so much.
Oh, you're very welcome.
And if you'd like more information on Arizona Vein and Laser Institute, log on to their website, ArizonaVeinandLaser.com, or call the number that you see right there on the screen.